Before I get into what this video is about, I just want to say that I spoke with my psychiatrist, obviously from the title, but I spoke to her about how the events that occurred, uh, how it was affecting me and not in a good way. And so we came up with a temporary solution, which is I am not watching any news until the inauguration day because I do want to watch that. um, and that will also give me time to reflect and calm down and all that stuff, and make a coherent video about it. I know I was going off on it. I do not regret anything that I said, and I meant everything that I said. But like I said, I want to come at it with a level head instead of just my emotions. So I want to be in my wise mind. Some emotions, but also you're thinking logically at the same time. Okay, so I just wanted to say that. I'm actually much happier not watching the news, so that's great. Okay, so let's get into this. All right, well, two things. There was also a different medication change, but that one was for a different medication. It was my metformin. Real quickly, I was on 1,000 milligrams, and then I went up to 2,000 milligrams, and I started getting like really sick and a metallic taste in my mouth. And I looked that up, and that's not good, getting metallic taste in your mouth. So I called my doctor's office, and she put in a prescription for metformin. I think it's 850 milligrams twice a day, but it requires 90 days, and she put in 30, and she's not in the office until tomorrow. And they just filled my old one. Now they're 500 milligram tablets, but you take, I started with the 500 milligram tablets, one twice a day. So that's 1,000 milligrams. And then it got doubled. And then now it's supposed to be 850. But the other one, I'm not even going to pick up. I'm just going to wait until tomorrow and call her and let her know that it has to be a 90-day supply. It's weird. It's not with all medications. It's just with certain medications with my insurance. I guess they like to pay in bulk. I don't know. Whatever. But that was that change. But this is the one that I wanted to talk about because this is mental health. So it's Doxepin. I've never been on Doxepin before. US brand name Silanor or Sinequan. I don't know if I pronounced that correctly or not. So it is a tricyclic antidepressant, which also the amitriptyline is also a tricyclic antidepressant. It works on the central nervous system, and I'm reading this from the Mayo Clinic, but I'm not going to read all of it. I'm just going to read some things like I usually do, and I will leave the, Mayo Clinic link, and then you can go check it out. Or if you're on it, please let me know how it went for you. By the way, I'm starting off at 25 milligrams, because she doesn't want me to start off, really high, and I don't either. And, if I need more, then, it can go up. Oh, sorry. It says it's used to treat anxiety, depression, and insomnia, which I have all three of those. So maybe it will help. I mean, I just started taking it Friday. And mine is a capsule. So, and it's oral route. Hold on, I'm just trying to get to the good stuff. Now, there's a list here of medications. it's a huge list too. That's why I'm not reading it. That if you're on this medicine, you're not supposed to be on any of these other medicines. So it's good to know that, if you look this up. So, hold on. Okay. I didn't realize there were so many pages. Oh my goodness. I'm sorry. Well, anyway, I've taken it for the last 3 days, and the first night I took it, it was really interesting. Oh, good. Here are the side effects. It was interesting because I didn't take oh, someone just called? Who was that? I don't know. Let me see. I don't know who that is. So the first night that I took it, that night, I remember falling asleep. Well, I don't remember falling asleep, but I remember getting really tired. And so I fell asleep. And I remember waking up sometime after I had fallen asleep. I don't know how, 1, 2 hours. I don't know how long it had been. It wasn't that long. And I woke up and I was freezing. Like, my mother had to bring in like 3 blankets just to warm me up because I was so cold. I was shaking. I don't know if that's a side effect. I haven't, I'm not sure. It could be. It could be that the amitriptyline didn't get into my system, and then I put something different into my system, and my body reacted that way. And I had like trouble sleeping at first, because I kept waking up, but I think part of that was due to the other issue that I have, with urology. So, yeah, but the second night I took it, I slept a little bit better. Although Saturday was not good because I tend to close the doors. There's like 2 doors, and I tend to close them because when my son wakes up, he has this annoying habit of, instead of getting up and getting his own food like a 15-year-old can, he decides to go, no, 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 like really loud. It's so annoying, and it woke me up. I couldn't go back to sleep. It was so annoying. So I don't know how long I would have slept. So I didn't exactly get 8 hours of sleep. I got maybe 5, maybe 6, which is better than 4. So, but, and then today I woke up early again because of, again, urology stuff. So, I'm not really sure how, I got to try to figure that part out. Because like this morning, I've been awake since 5. I tried going back to sleep, but it just didn't work. I'm sure you can tell I look really tired. I do. I look tired. Not as tired as I've looked, but I do definitely look tired. So, we'll see. We'll see how things go. I meet with her again, I think next month. So we'll see how it goes. Oh, she also wants me to keep a mood diary and to keep track of my anxiety and when and in what type of situations or people that I'm around, like when is my anxiety, when is it high, when is it low, medium, whatever, just kind of keep track of it. So that's something that I need to do. All right, so let's go over some side effects here. So you need to check with your doctor immediately with these ones: agitation, black tarry stools, bleeding gums, ugh, blood in the urine or stools, blurred vision, burning, crawling, itching, numbness, prickling pins and needles or tingling feelings. I guess it means anywhere on your body, maybe not just your hands and your feet. I don't know. It doesn't say hands or feet. It just says tingling feelings. Canker sores, chest pain or tightness, chills. Oh, well, hey, I got the chills, but like that one night. Clay-colored stools, cold sweats, confusion about identity, place, and time. Let's hope that doesn't happen. Cool, pale skin. Do you guys think I look pale? Cool, pale, for me. I'm not wearing any makeup whatsoever. The only thing I have on is chapstick. That's it. No, there's no lotion or nothing on my face. Cough or hoarseness, dark urine, decrease in the frequency of urination, decrease in urine, decrease urine output. Okay, lots of urine stuff there. Depression. Well, I already have depression, so I don't. Difficulty in passing urine, dribbling. Difficulty with breathing. Difficulty with speaking. Dizzy, faintness, or lightheadedness when getting up suddenly from a lying or sitting position. Drooling, dry mouth, fast pounding or irregular heartbeat or pulse. Sorry. My son's coming downstairs. I think he's done with school. Fever, flushed, dry skin, fruit-like breath odor. Hold on. Yes. I'll show you this real quick. I'm making a video. Hold on. Show me here. I will be right back, guys. He needs to show me something. Brighten up my day. Oh, sorry about that, guys. He just showed me a thing on TikTok. That's funny. I'm sorry. All right. So, general feeling of tiredness or weakness, headache, hearing loss, hostility, increased hunger, increased thirst, increased urination, irritability, itching or rash, lethargy, lip smacking or puckering, loss of appetite, loss of balance control, loss of bladder control. Wow, there's a lot of bladder issues that can happen with this. Okay. Lower back or side pain. Mood or mental changes, muscle spasm or jerking of all extremities, muscle trembling, jerking or stiffness, muscle twitching, nausea, nervousness, nightmares, noisy breathing, painful or difficult urination. Oh my God, so much urination stuff. Pinpoint red spots on the skin, pounding in the ear, of the cheeks. Okay, I don't think I have that. Rapid or warm like movements of the tongue. Rapid weight gain, redness of the face, neck, arms, and occasionally upper chest. Restlessness, ringing or buzzing or other unexplained noise in the ears that continues. Seeing, hearing, or feeling things that are not there. Seizures, shakiness, and unsteady walk. Shakiness in the legs, arms, hands, or feet. Shuffling walk. I hate when people shuffle when they walk. I mean, if it's due to this, that's one thing, but when they're purposefully not picking up their feet, it's like, oh, come on. That bothers me. I don't know why, it just does. I was taught to pick up my feet when I walk. Sore throat, sores, ulcers, or white spots on the lips, tongue, or in the mouth. Okay, don't have that. Slurred speech, stiffness of the limbs, stomach pain, stupor, Sudden loss of consciousness. Well, that's not good. Sweating, swelling of the face, ankles, or hands, swollen glands, trouble breathing, twisting movements of the body, uncontrolled chewing movements, uncontrolled movements, especially of the arms, face, legs, neck, and back, unexplained weight loss, unpleasant breath odor. I feel like they already said that, but I think they said fruity breath, but this says unpleasant breath odor, so maybe it ain't fruity. Unsteadiness, trembling, or other problems with muscle control or coordination, unusual bleeding or bruising, unusual tiredness or weakness, vomiting of blood, yellow eyes or skin. Well, I hope I don't look yellow. I don't think so. I mean, I don't feel that. I mean, my cheeks are a little bit red, but then again, the doors are closed and I've got my hair down and that makes me warmer, so. Oh, get emergency help immediately for these following symptoms of overdose. Oh boy. Clumsiness, disturbed concentration, drowsiness, enlarged pupils. I don't think, can you see my pupils? I don't think you can. I mean, I can see them in the mirror, but my eyes are, no, you can't see them. That's really weird. Well, you can kind of see them, but I do have pupils. I do. Increased or excessive unconscious or jerking movements. So I'm assuming you're sleeping. Low body temperature, muscle aches, muscle weakness, shivering, sleepiness, weak or feeble pulse, weight gain. Incidents not known for these side effects, change in taste or bad, unusual, or unpleasant aftertaste. Decreased interest in sexual intercourse, diarrhea, difficulty having a bowel movement, stool, enlargement of the breasts. I really don't need that. Gas in the stomach. Oh, I'm sorry, guys. Oh, that was my alarm. Sorry, gas in the stomach, hair loss or thinning of the hair, heartburn, inability to have or keep an erection. I don't have to worry about that one. Increased in sexual ability, desire, drive, or performance. Well, that might not be a problem for people who have been married forever and have like 10 kids. I mean, well, if you got 10 kids, I guess you don't really need that. I'm trying to think how that could be bad. I mean, maybe it's like overkill in what's happening, like all the time, like there's never any break. It's like always, you know what I mean? Like maybe that's what it is. It's an unusual increasement of it. So that's the only way I could think of it. Increased interest in sexual intercourse. Yeah, see, that's probably what it is. Increased sensitivity of the skin to sunlight. Loss, excuse me, in sexual ability, desire, drive, or performance. Redness or other discoloration of the skin. Severe sunburn. I wonder if you have to be in the sun to get the sunburn or if it just causes it just by taking it. That's a good question. Swelling of the breast or breast soreness in both females and males. Yeah, I don't need swelling. Swelling of the testicles. Well, I don't have to worry about that. Unexpected or excess milk flow from breasts. Well, is that if you're breastfeeding or just in general? Weight loss. Okay. All right. So yeah, I'll let you know, you guys can read all the other stuff. But I just wanted to read that to you so you guys had an idea of it. So it's an antidepressant, it's a tricyclic, and both the doctor for my neurological stuff, my brain stuff, my sleep stuff, talks with my psychiatrist. Sometimes it's over the phone, sometimes it's sending notes back and forth and whatnot. So they're, you know, they discuss in a way what type of medication might be helpful to get me to wherever it is I need to be, which is stable, whatever that looks like. I don't feel stable entirely. I feel a little bit better than I have. Oh, I'm sorry. I feel a little bit better than I have. And, like last year, I felt horrible. The year before, I felt horrible, but I'm starting to feel a little bit better. And I think it's because I'm doing the exercising, I'm eating the healthy foods that I'm supposed to eat, I'm checking my blood glucose, I'm taking my meds like I'm supposed to. I'm going to the doctors, I'm going to counseling, I'm going to my group, you know, I'm doing everything that I'm supposed to do. So, hopefully this will work. I mean, you never know. I did talk to her briefly about possibly in the future, depending on how things go, going on a mood stabilizer because my moods change all the time. And yes, some of it is from BPD, but some of it is also from, bipolar. And um, I just, I don't, I guess if I became hypomanic or manic, and she saw that, then it would probably make her see, because the thing is that a lot of times for me, I am more in the depression phase than I am in like a manic or hypomanic phase. Um, and sometimes the depression can last much longer than any hypomanic or manic state I've ever been in. Actually, it has been that way. Those periods are shorter. And with the stuff that I had going on, I was definitely in the down side of things. And I'm not, I don't think it's bad to have an upbeat outlook or be more upbeat because I feel like I'm a little bit more upbeat. I mean, tell me if you think I am or not. I don't know. My doctor thought I seemed a little bit different when I talked to her. One of the differences between when I talked to her on Friday and when I've talked to her every other time is that every single time my mother has been a part of the conversation. And so I'm different. Do you know what I mean by that? Like when somebody kind of talks for you and then says things and takes up the time so you don't have time to actually talk. And when you do talk, it's like, okay, we only got 5 minutes. It's like, oh, okay. This time I was able to talk to her by myself. And she said I seemed, different. And I'm like, and I said to her, I asked her, I said, well, who isn't here that has always been here since the first time I saw you? And she went, your mom's not here. And I said, yeah, I'm a little different when my mother isn't around. I'm more me. My mother likes to kind of put me down, and I don't think she realizes that she does it, or if she does, that's even worse. But if she doesn't realize it, like I had a talk with her and I had an emotion and I expressed it about something. I don't even remember what it was. And she told me something about, you shouldn't feel that way. You should feel this instead. And I'm just like, listen, stop invalidating my emotions. I'm allowed to have them, whether they make sense to you or anyone in this world or not. And I may change my mind, but you can't make me feel something I don't want to feel or I don't feel, you know. And I'm allowed to have my emotions. I'm allowed to have my thoughts. Doesn't make me right or wrong. It just makes me human, and it's okay to feel whatever I'm feeling. I'm allowed to. And I said, stop, making it seem like I'm like, I told her, can you not stop trying to manipulate my reality? Telling me, no, I should think this way, or I should think that, or no, you're wrong about that, or you're wrong. You don't know if I'm wrong about something unless you actually have to back it up. And most of the time, no. It's more about well, I've been alive longer than you. Well, good for you. You know, that's okay. So, but I've been trying to put boundaries down. Um, and I asked, not like meanly, but just, you know, not, I don't want to say forcefully, but um, I said it with, oh, I don't know what the right word is to use. I guess boldness, whatever word, I can't think of a good word to use, but I said it, I guess, sternly, but not meanly. And I just said, please stop disrespecting me. Please stop telling me my thoughts and my feelings are wrong, because they're not. They're my thoughts and feelings, and I'm allowed to have them, you know. And I set, you know, I keep setting boundaries, you know, like when, um, for instance, the other day, we had a friend over and he didn't want to talk about something. And I talked about it a little bit more, but on a different level. And then I stopped. And he kept saying that and saying it like, I don't care. I really, I zero F's, you know. That's what he did. He says, I give zero F's, you know. And my mother would not stop talking about it. And I'm like, Mom, he said he doesn't want to talk about it. And then she's like, but I have a question. And I'm like, he said he doesn't want to talk about it. Don't ask him. But it's just a question. And then she did the same thing to me yesterday or Saturday. I can't remember what day. But she did the same thing to me. I said, no, I don't want to talk about this. Please stop. And I said, listen, I said, stop. I'm not talking about this with you. I don't want to talk about it. So please stop. And she's like, yeah, I said, yeah, but nothing. I asked you to stop. So please be respectful and stop. You know, it's like she doesn't hear. She doesn't listen, you know? So that can be difficult. I'm hot. I need to open the door. Woo! So yeah, so far, so good on the Doxepin, I think. You know, it takes a while for your body to get used to a new medication. Um, and, you know, I'm going to keep track of my moods. I'm going to keep track of my anxiety and stuff like that. And in a month, we'll see where we are. I don't know. Hopefully it works. Hopefully I get sleep. That would be nice. So, yeah, but anyway, if anyone has been on this medication or is on this medication, can you please tell me how it worked for you, or if it didn't work for you, or the side effects, what were the benefits, you know, that kind of stuff, or if it didn't work for you, or the side effects, what were the benefits, you know, that kind of stuff. Doesn't have to be like a big long thing, but just like, this worked for me, here were the things that didn't work for me, would I continue taking it, yes, no, end it, yes, no, you know, that type of thing. I just want to get a quick review, if you would be so kind. So yeah, all right, that's all I wanted to talk about. Hopefully the med changes, well, this specific med change, because this is mental health, the Doxepin hopefully works. And if not, we'll see. I don't know if she will want to increase it or try something else. I have no idea. We'll see. All right. I love you all. Please take care of yourselves and one another. You know, be kind out there. Wear a mask. Wash your hands. Stay 6 feet apart as much as you can. And I will see you in the next video. All right. Peace and love. Bye, guys.